Good afternoon, everyone. We're going to go ahead and begin the 2024 School-Based Healthcare Educational Series Lunch and Learn, Applying a Trauma-Informed Lens in School-Based Healthcare. Thank you for joining us this afternoon. The Ohio School-Based Health Alliance is a statewide organization that was created to advance and support the sustainability and expansion of school-based healthcare. We were founded in 2002 as the Ohio School-Based Healthcare Association, relaunched statewide in 2021 as the Ohio School-Based Health Alliance, and have been a state affiliate of the National School-Based Health Alliance since 2010. This is the vision and mission of our organization. We are working towards improving access to comprehensive, integrated health services through school-based healthcare to advance equity and improve health and education outcomes for students, their families, and communities. The areas you see here are where we focus our work around capacity building, policy transformation, and data tracking and evaluation. Start with some introduction. So my name is Ree Malley. I'm the Executive Director of the Ohio School-Based Health Alliance. And joining us today in our Lunch and Learn is Amy Hawthorne, who is the Trauma-Informed Care Coordinator with the Ohio Department of Mental Health and Addiction Services. Amy received her undergraduate degree at Ohio University and her graduate degree in Public Policy Management at the John Glenn School of Public Affairs at The Ohio State University. And she has worked in prevention and victim services for 10 years, has helped to qualify prevention program interventions, and in her current role is strengthening the trauma-informed care regional collaboratives and meeting community-specific needs, enhancing successful trauma-informed care programs across the state. And we are so thrilled to have her here joining us to give us a deep dive on trauma-informed care in school-based healthcare settings. With that, I will turn it over to Amy to share more. Oh, Amy, just making sure that you can unmute. There you go.
Thank you. There I go. Thank you. I appreciate the introduction. Reem, I'm very happy to be here with the Ohio School-Based Health Alliance. And the slides that you'll see coming here are, just for CE purposes. And I just wanted to remark that I have no conflicts of interest in regarding the CE, CEU, or any sort of financial disclosures. There's no conflicts here. So great, thank you for forwarding my slides. If you keep going, this is transforming culture through relationships using trauma-informed practices in educational settings. The next slide, please. These are just my credentials and the title again. And if we're moving on to the next slide, it will give us our objectives for today's learning session. So the objectives are for participants will reflect on ways that they use the relationships that they have to contribute to trauma-informed, thriving, and supportive environments. And our second objective for the day is that participants will consider the changes their school or organizations could make to move from fear-based discipline to relationship-based discipline. And I understand that many in our audience are not necessarily in a position of power where they can create environmental changes for their schools. And so we will talk about individual things that we can do, to help move and shift and increase trauma-informed care. And our third and final objective for the day is that participants will plan one strategy that they will employ to bring more connection and joy to their school or organization. Next slide, please. And what is trauma? So just to give you all a brief understanding, I use the SAMHSA definition of trauma. And I also wanted to let you guys know that during the beginning of this presentation, I will be moving more quickly towards the slides because there is a lot of information that we'll cover that is widely known. So I will be moving quickly towards the towards the beginning, but we'll slow down pace towards the end once we dive into the tools and techniques and things. But this is the SAMHSA definition of trauma, and it's understanding that individual trauma results from an event or a series of events or a set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening and has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. Traumatic events may be experienced as an individual, a generation, or an entire community or culture. Next slide, please. So out of understanding trauma has become the practice of trauma-informed care. And you'll see throughout the presentation that I have abbreviated trauma-informed care to the word TIC. So TIC, trauma-informed care, can exist in numerous spaces and environments. It is the assumption that an individual is more likely than not to have a history of trauma and recognize the symptoms and acknowledge the role trauma may play in an individual's life. And if people are familiar with ACEs or adverse childhood experiences, we know that 64% of adults have 3 or more ACEs. So that being said, we just trauma-informed care operates under the assumption that more people than not have a history with trauma. And so we don't necessarily need to ask people questions about their experiences or about their past traumas, but rather we just assume that they may have a trauma history and proceed accordingly. And then I also like to include that trauma-informed care can incorporate all of our senses, the things that we're hearing and taking in with our ears, the sounds, the things that we're taking in with our smells, and like walking into a room and how it smells and what we see. So trauma-informed care can encompass all of our senses. And moving on to our next slide, we see that the reason that we use trauma-informed care is because it equips our agencies, our organizations, and individuals to prevent adversity, respond to trauma, and promote healing and resilience. So if we're using trauma-informed care and we have somebody engaging with our systems or sharing information with us, they're more likely to, and we use trauma-informed care, they're more likely to continue that engagement and see us as a safe, trusting adult, safe, trusting peer, and they're more likely to grow that connection and nurture that connection. And those connections are what promote resiliency in an individual. So we use trauma-informed care to promote resiliency. And then it also, trauma-informed care does not necessarily need to be super technical. It's something that we can use in our everyday lives. But it does, having a practice, a trauma-informed practice, promotes strong connections, which then leads to strong resiliency. Next slide, please. So our relationships and trauma-informed care and our trauma-informed spaces. And so I just wanted to give you a background information and understanding that through relationships, trauma survivors can learn to feel safe, trust others, learn new ways of relating to people, and develop self-compassion. And this comes from van der Kolk, and that is an excellent resource if anybody's interested in more resources. And then my second bullet here is that relationships are one of the key factors of resilience in trauma-impacted youth lives. They are the bedrock of trauma-informed care. And so we'll see later on in the presentation that we do not necessarily, need to be therapists to be therapeutic. And there are ways that we can infuse trauma-informed care in the way that we move and operate in the spaces in which we work and live that can help to promote resiliency and stronger connections with the relationships that we build. Our next slide, please. Okay, this is just a great model. And I know that you guys are in schools, school-based health. So a lot of you are operating clinics or small spaces within schools. And so I just kind of wanted to give you something that could be related and relatable for you, and students being at the core. we have staff and caregivers beyond the students, and then system and leadership even beyond that. And then you'll notice that sort of the outside petals of this model are can be understood as pillars of trauma-informed care. And if we have all of the petals protecting that core, then we can, operate under this model. Next slide, please. Here, within our next couple of slides, I'm going to be getting a little bit more technical. And what I want you all to understand is that you can feel free to ask questions in the chat, and I will be saving some time towards the end of our presentation for questions as well. So as I move into the more technical information, please feel free to put a question in the chat or keep it to the end. So this is just a small way in which that we can synchronize neural rhythms. And the reason why I included this slide is because it helps to create a space that maybe somebody's going to come into for help, and thinking about how we want to manage our energies to match and sync up. And one of the most important things that I have heard doing this work is that a calm nervous system calms a nervous system. And so I kind of always remember that in the back of my mind when I'm thinking about corresponding or having a conversation with somebody who's dysregulated, right? A calm nervous system calms a nervous system. And so that's why it's important to think about synchronizing our neural rhythms. And one small example that I found that I wanted to share with you all was the thing about having music playing or background music. It doesn't necessarily need to be loud or jarring, but while listening to music, you might find yourself tapping your foot or bobbing your head to the beat. What you might not have expected is that as you listen to your favorite tune, the rhythms in your brain are also following along. Music has been shown to be an efficient method of modulating emotions and sort of autonomic nervous system activity, and it potentially is a very low-cost intervention and therapy that can be easily implemented. Music induces both high relaxation and low tension subjectively in young adults. So if you are working with students who are coming into your spaces who might be scared or nervous about something that they've just experienced, or maybe have had experienced trauma in the past, or several traumatic events, thinking about a way to help get a person feel comfortable and feel safe is thinking about that synchronizing neural rhythms, which is easily accomplished with some sort of background music. And then also with this, though, it's important to remember that there is a difference between being safe and feeling safe. So this means that a person can be safe, right? They might be 100% safe in your space, but they might not feel safe. And that is especially true for people who have experienced trauma at the hands of their primary caregiver, right? And so if you're creating a safe space, it might not feel safe to that person. So that's just one thing to keep in mind. And I would like to go to the next slide, please. Okay, so continuing with a lot of technical stuff, but our next slide is going to be very technical, but I wanted to give you a background with some visuals of where we will be coming from. So the brain stem in the survival state, you'll see that that person who's using is operating from their brain stem is in a fight, flight, freeze, fawn, all that like chaotic space. The amygdala, we're operating out of an emotional state. And if we're using our prefrontal cortex, we are using those executive functions. We're thinking about rationality, we're using logic, and these can be very, confusing for children and as young adults, and also very confusing for adults as well. So I just kind of wanted to keep you or make you aware of the three different states. And in our next slide, we will go into greater detail. Thank you. So the hand-brain model is an excellent, and you guys may have heard of this hand-brain model, but it's used very often in trauma-informed care. And it's because we're wanting and encouraging people to be wanting to operate and use their prefrontal cortex, that logic and rationality place of their brain. But we know with people who have experienced trauma, and we know with children, that it's not always possible. So we like to use this model so that we can let the people know, the people that we're engaging with, what we're trying to achieve. So brains are built through a combination of experiences and genetics. Our reaction and responses are a product of our brains firing, right? And which part of the brain we're using. However, our brains are plastic and we have the desire to heal and build new neural pathways. This is why our relationships and connections are so important, because if we experience healthy connections, and if we know that, like, when we make a mistake, that it's going to be okay, that helps to build new neural pathways in our brain. So the hand brain starts between your wrist and your elbows, and this represents a brainstem. Your brainstem is in charge of all of your bodily functions that we do. We don't need to think about, right? We don't necessarily need to remember to breathe or digest food. And that just happens. One function of the brainstem that we have partial control over, though, is our breathing, right? In fact, when we breathe out, it is calming. Most of us only notice 30% of what is happening around us. If a person with autism spectrum disorder or has experienced trauma, the brainstem allows more information into the brain, which becomes overwhelming very quickly, because all of this information is just coming in, and it might create a fear center. It's because it's overly stimulated. And for people who have experienced trauma, or if they have autism spectrum disorder, it can be very overwhelming. So the limbic system, represented in your hand brain by your thumb. So if your brainstem is on your wrist, and then your limbic system is represented by your thumb here. So you place your thumb across the palm of your hand, so that's lying on top of the brainstem, and this is in charge of three very important things. The limbic system is in charge of felt safety, which allows you to feel safe, hopefully, when you are safe. Trauma can sometimes reverse this, causing you to feel unsafe, and causing you to feel safe in unsafe situations, and unsafe in safe situations. So we did kind of touch on that already. And all of the information that enters the brain goes to the fear center so that it can be decided as safe or not safe. So when the brainstem is letting in extra information, the fear center can become easily overwhelmed, right? So this is thinking that a person who has experienced trauma, or is maybe on the autism spectrum disorder, so they become easily overwhelmed, and all of that overwhelming information can go to the brain's fear center. So when that happens, the next part of the limbic system, the attachment center, which allows us to work cooperatively with others, that goes completely offline. So therefore, I know I'm talking a lot here, but I want the crux of this is the limbic system is in charge of felt safety, attachment, and regulation, right? So we need our limbic system to feel safe. The limbic system also controls all types of memory, time, and the circadian rhythm. This means when the limbic system is overwhelmed, the individual will have a difficult time functioning on many levels. And this isn't even necessarily talking about executive function, right? This is talking about people operating out of a overwhelmed limbic system. They're not feeling safe. They're not feeling regulated physically or emotionally, and they will not be operating. So thinking that if the limbic system is offline, they're very overwhelmed. And so what we need to do, the final part of the hand brain model, which is what we can do to help, is when we have somebody's limbic system overwhelmed, the final part includes your four fingers, which are up here, right? And that what we want to happen is to wrap around our thumb. And this represents our cortexes. And so otherwise known as your thinking brain. So this model has come from Dr. Dan Siegel. Sometimes he calls this sort of the upstairs brain, right? So our upstairs brain is because it's the only part of the brain we have conscious control over, and it is only allowed to work when the limbic system feels calm and gives permission. So when you're stressed out, your upstairs brain goes offline as well. And that's what Dan Siegel calls flipping the lid. So I know I'm kind of unfocused, but we want to get people in a regulated state so that their prefrontal cortex is wrapped around that limbic system and people are feeling safe and they haven't flipped their lid. And so all of this is tied to the hand-brain stem areas, all tied to our vagus nerve, which is found in the spinal column, which is represented by the forearm in the hand-brain model, and sends your emotions to every organ in the body. So there is a lot of science behind this, obviously, the way that our bodies are physiologically reacting to stress, right? And so just to sort of do a quick review summary, the brainstem represented by the palm of your hand is in charge of automatic functions like breathing, digestion, heart, bladder, etc. The limbic system, represented by your thumb, is in charge of the felt safety, attachment, regulation. And the cortex is represented by your four fingers wrapped around your thumb. Those are, though the cortexes are called the thinking brain, the only part of our brain that we have conscious control over, only allowed to function when the limbic system feels safe. So that was a lot, and I'm ready to move to the next slide unless anybody has any questions. I'm going to pause there for questions because it was very technical. Okay, great. So the four elements of connection, which are things that we can all do in our workspaces to agree, especially when thinking about trauma-informed care, all learning and understanding of trauma-informed care begins with connections. Connections on the outside with other people actually create and strengthen neural connections within our brains. This is true for people of all ages and especially youth. And so some easy things that we can do is eye contact. We can get down on a child's level to achieve eye contact. When eyes meet, a wireless connection is created between the orbital frontal areas of the prefrontal lobes. The eyes contain nerve projections that lead directly to the brain structures for empathy and matching emotions. As soon as you have eye contact, embrace your inner calm. Remember that a calm nervous system calms the nervous system. And so there you are, you're safe, breathe with me, you can handle this. Those are all things that you can say to a person who is becoming dysregulated. There you are, you're safe, breathe with me, you can handle this. Mirror neurons ensure the moment someone sees an emotion on your face, they will at once sense the same feeling within themselves. That's why it's very important to react to things calmly and not have big facial expressions and be like, oh my gosh, I cannot believe that. I'm so sorry. Like, it's okay to react calmly and to make eye contact so that the mirror neurons can connect and sense that feeling within themselves. So that's eye contact. And the next one we go over is touch. Touch is the only sense that we cannot live without, right? The skin and the brain are made up of the same embryonic tissue. Skin is the outside layer of the brain. Touch creates a hormone that is, essential to neural functioning and learning. If we want smart, happy kids, then we need to provide more appropriate caring and touch. But I would just like to caution people that we want to ask permission before we touch somebody, because touch can also have an adverse effect on somebody. And even if you're getting close to a person, you might say, is it okay if I move a little closer to you? And then definitely if you are going to touch somebody, you could say, is it okay if I give you a hug? And listen to them and let them know that they're allowed to say no, and that it's completely okay for them to say no as well. But touch is a form of connection and it is important, but we always want to definitely make sure that we have consent and understanding around what the person feels comfortable with. The next connection that I want to discuss is being present. Being present in the moment means that your mind and your body are in the same place. Has anybody ever driven to work and gotten to work and been like, oh my gosh, I don't even remember how I got here because it's so automatic. It's something that you do on a regular basis. That means that we were not present in that car, right? Our mind and body were maybe not in the same place. So being present is the opposite of that. So our mind is free from chatter, free from clutter. We're not thinking about what's going to be happen or what had happened. You're still enough to see the beauty around you. And if you are treating a child, you are able to be with that child in that space. Presence is about acceptance as we join together and share the same moment and find whatever we might find into it. And so it's easy. Breathing can always bring people back to presence and help to quiet the mind. And another way that we can show being present with somebody that we're caring for is by asking questions and really hearing what they're saying. And then also what is going to be very helpful with presence is to, like, if you have to administer some sort of exam with a child, you might let them know what to expect and what's coming forward, and then ask them if they're nervous about any parts of the exam and is there anything that they need more information about, and kind of talking about what's going to happen in that moment so that it can increase the presence between both people. And then the last form of connection is playfulness. Playfulness helps build bonds and create a biochemistry in the brain for dopamine. So dopamine says, pay attention, stay focused. Playful situations strengthen the dopamine system and increase attention spans and boost social development. People are feeling good when they're feeling playful, and that's something to capitalize on. Okay, if we could move to our next slide, please. Acceptance and belonging. This is just something I wanted to add because a sense of belonging involves more than simply being acquainted with other people. It is centered on gaining acceptance, attention, and support from other members, from all members of the group, as well as providing the same attention to other members. We need self-awareness to recognize where and how our energy and our attention is spent. And we also need self-awareness to recognize if we're not being fair to each person that we're serving, and making sure that, people are feeling welcome and accepted, because then they're more likely to share and then more likely to connect, and connection builds resilience. There is a primal desire of being and feeling included. We all want to be seen and heard. And this can go a very, very long way. Our next slide, please. And these are integrative complexity and interactions. And so this is a tool thinking about relationships and interactions with people and how we can build strong connections. So integrative complexity is about how you individually process information, right? So people who have this skill, they think that there is more than one way to look at things. So this requires us to think, to think that, like, my way is not the best way. The way that I would do that, oh, that's not the way that I would do it. I don't know if they're doing it right? So we need to have the self-awareness to understand that there's more than one way to look at things. This skill also requires people to successfully create links between disparate things and bring them into a coherent overall resolution. So basically, we can practice this by not forming rigid or one-sided opinions about anyone. This helps with our communication and interactions with others. Additionally, it is helpful if we create links between disparate things and bring them into a coherent overall resolution. We strive to develop and entertain opposing views and ideas and then integrate them into a larger creative wholes. Things are not simply black and white, and we try to make the most of the gray areas. And so one thing that I think of when I think about doing this for myself in a practice is years and years ago, I used to do a lot of work in schools, in school classrooms. And I would go in and see different students, and I would talk to a lot of teachers and school administrators, and they would offer a lot of information right up front, which is also very helpful, but it might create biasy. It created some bias in my head. So that being said, like I heard a lot of people warn me about certain students or, tell me about, certain students like being bad and this or that. And if we're thinking from a trauma-informed care lens, we don't operate from a what's wrong with people lens. We think more about, what happened to people. And there is a reason why a person is behaving a certain way. And we'll dive into that within this presentation. But if we hold and practice integrative complexity in interactions, we're less likely to share those biases that we might have and hold about certain people that we work with or the people that we're serving. And so this is trying to help us use more with the gray areas. Next slide, please. So this slide, we were just looking at the basis of relationship-based discipline. Relationship-based discipline is defined by examining differences between values and practices, moving away from punishment and fear-based practices, moving towards relationship-based discipline, which focuses on teaching new skills to replace maladaptive behaviors. And it also focuses on restorative practices that understand conflict is inevitable. Focusing on repairing relationships is very strong. Empowers individuals to make it right and individualized, equitable, and inclusive. So those are some restorative practices. And that second one there, focusing on repairing the relationships, is very, very valuable. So especially if a young child or a young adult in a school setting has experienced houselessness with their family, or one of their caregivers have been removed from the home because they are maybe incarcerated, or they may be having substance use disorder issues. Because the thing is that they have an understanding they have an understanding that people leave, right? And that maybe there's like some abandonment issues there and things like that. So we really want to strongly build up focusing on repairing relationships and letting people know that, like, we're gonna work through it. We're having a conflict right now, but it's not the end of the world. We can work through this. We can figure this out. Letting students know that we're going to figure this out helps to repair relationships, and it helps to give them different neural pathways. So when we are faced with challenging behaviors, let's ask ourselves helpful questions. What is this challenging behavior? Where is this mostly occurring? Does it occur in one place? Is it occurring in many places? How could this behavior have helped that individual survive, feel safe, or feel connected? And then what is a new approach that we can try to meet the felt safety or connection need that is driving this behavior? And then who can we include or employ to try and use this new approach with this person? And let's move to our next slide, and we'll go into some examples. Thank you. So again, one that needs to be a therapist to be therapeutic. And so if we see somebody using manipulation, their hidden resilience is often resourcefulness, right? And so what the feeling is that they're afraid of asking directly for what they need or want, right? And so you can practice with them, practice with safe people directly asking for what I need or what I want. And so the intervention could be without shame, help them identify the difference between wants and needs, identify safe people to ask, develop with them the words to ask directly, and practice asking directly. And I would say that that one is like the big one there is helping them identify the difference between wants and needs. And then the next challenge or struggle that we're going to move into is lying. We've seen lots of experiences probably with people lying, and that we're going to go into, we have a couple of other examples of lying, but this lying hidden resilience is this person is determined and creative. And they're also very afraid of punishment, because the punishment that might have come on the other end could be very, very hurtful, very, very abusive, right? And so they might lie as not to be punished, right? So this person, they need to be told and shown that this is a safe place to make a mistake and to tell the truth. And that once they do tell the truth, and after they do make a mistake, that they're not chastised and told like, why did you do that? Like, oh my gosh, and can't believe you did that again. It's they need to be taught differently. And the interventions could be to identify safe people to ask, develop with them the words to tell what really happened, and to practice saying what happened and highlighting that they are still safe. And so here we want to really kind of help somebody find the language, find the words to tell the truth about what really happened, and say, I can still understand why you did what you did, but it's, we need to get down to you speaking the truth and how that's okay too. And so moving on to our next slide, please, with some more examples. Here's some more examples that we have of lying. So again, the hidden resilience is determined and creative, and the feeling is try to meet a perceived need. The need is help identify the need and finding a new way to meet it. And this is about the intervention here is to focus and reflect the inner wish need, not the accuracy of the content, right? So we really kind of want to understand what they need, and what they wish. Maybe they are needing to feel more involved or included. And so we can kind of help and figure out we can kind of help and figure out what the real need is and focus and reflect on that. And the next example of lying is also determined and creative, and this person is trying to solve a problem. And they're trying to solve a problem without being shamed. And so we want to help explore other ways to solve the problem. And like this might, an example here is like, if you've asked a person to, did you take home your permission slip? Yeah, I took it home. And you'll find out that they didn't, right? And so how are we going to explore other ways to solve the problem? We want to help them identify the problem, empathetically reflect back to them what the problem as they see it. It's very important to see things from their perspective so that we can understand where they're coming from. And then you work with them to problem solve and come to a solution, and use the creativity to help them develop a plan with concrete steps. So remember, the key is that to remember that your way of being and your way of interacting as an adult, especially working with youth and young adults, is that you want to understand where your attention goes, because that's where your energy flows, and that is what grows. So I know that there's lots of things throughout the day that can make us very frustrated, but we want to make sure that our interactions and that our energy and our regulation stays calm, so that they can then mirror those responses. Okay, moving on to our next slide, please. So this is where we're going to dive a little into the HOPE framework, and I encourage everybody to Google HOPE framework if you haven't already, because HOPE framework is the Healthy Outcomes from positive experiences. And these are things that we can all make sure that we do, right? The Hope National Resource Center is based in Tufts Medical Center in Boston, Massachusetts. Hope is creating a paradigm shift in systems of care and communities. They're also hoping to shift policies to value and actively bolster positive childhood experiences. So positive childhood experiences are called PACEs instead of ACEs. And Hope offers research, resources, trainings, and technical assistance to help bring the power of the positive into the lives of children and families. And we actually could have spent a whole hour talking about the Hope framework, but I definitely would encourage all of you to take a look at that when you have some time, because their website has multiple resources and trainings on how individuals can practice their use of positive childhood experiences or PACEs. And again, these experiences, their 4 pillars are recognized up there as relationships, the environment, engagement, and emotional growth. The next slide, please. And these you might not be able to see, but you can also find this on the Hope Framework website. But these are 4 building blocks or pillars that are important in recognizing for growing up healthy. So these healthy building blocks give us actual tools that we can use, right? So these are actually questions in each of the blocks, and they are questions either focused on engagement, relationships, environment, or emotional health. And they are, giving us some tools for our toolbox about some questions that we can ask. And I'll just give one example of each. So for engagement, you can ask, what is your favorite sport or activity? Relationships, which family story are you proud of? Environment would be describe your safe space, and emotional health would be how do you take care of yourself when you feel sad? And I love that environmental question for this audience specifically, like describe your safe space, because you can then know what their safe space looks like, and you can ask them, like what it feels like. And then if you have to, like say you're doing an exam, or you have to do something that's going to make them uncomfortable, or you have to give them some sort of shot or something, you can remind them to visualize what their safe space. So these questions help to build connections around the things that we're asking. But remember that you also have to listen to the answers to their questions, and that we want to make sure that we're keeping our questions curious and not interrogative. And that we want to start kind of slow and understand where they might be coming from and operating from. And we want to definitely make sure that they're listening and that they feel heard, so that they feel safe sharing any information with us that they can about any unhealthy experiences that they might be enduring in their home spaces or in their school spaces. And so this is sort of like the building blocks, the foundation. Next slide, please. And for here, just very quickly, I'm going to move very quickly through this slide because again, I don't know how much power or leadership that everybody has in their schools, right? And we can't necessarily change how administration is going to move from a fear-based relationship to a relationship-based discipline, or you might already have relationship-based discipline in your school. So I wanted to just let you know that there have been examples out there, and that Bellbrook Intermediate School is a school system around Dayton, and they moved from fear-based to relationship-based. And if anybody has any specific questions about that, I'd be more than happy to go into detail about what they did and how they did it. And I would encourage you to reach out to me and ask me any questions, and I could put you in touch with some other people. But I won't go into detail just because that's not necessarily the time well spent here. But I just wanted to let you know that there is examples and models out there that I would be happy to discuss. And then the second bullet point here is the Meyerson Center for Safe and Healthy Children. So the Mayerson Center is out of Cincinnati Children's Hospital. They are a wealth of knowledge for trauma-informed care here in Ohio for anybody working in a school. They have tons of free trainings. They have so much information for educational and school-based settings. And so I would encourage everybody to look up the Mayerson Center for safe and healthy children and see what you might be able to, further your education in around trauma-informed care. Or, I've seen the Mayerson Center implement whole school-based trainings in certain districts. And so they are a wealth of information. And then I also would like to encourage you all to share any ideas that you might have for what might work. But I would like to open up the time now for any questions or suggestions. Oh, 3 minutes ahead of schedule. Wow, okay.
If you have questions, feel free to put them in the chat, and we will be sharing a copy of the slides and a recording with all of the registrants of the Lunch and Learn, so that will be available.
And then I also would like to put my email in the chat too for people. So I am also, as a trauma-informed care coordinator, I am a resource to you. And I do work closely with lots of schools and lots of school districts. And so if people have different ideas or things or programs that are working at their school or anything, I am very always open to conversations and meetings. So just please reach out.
Thanks, Amy. Questions for Amy? And feel free to unmute if you have a question as well. Don't see any questions in the chat box.
Well, that's okay. Yeah, no problem. I just all appreciated you being here and being interested in trauma-informed care. And like I said, if you guys ever need anything, just let me know. I'm here to help.
Thanks, Amy. I think you've shared a wealth of information. We'll make sure that's available to all of our attendees today and registrants for the Lunch and Learn, and even broader to our partners. And before folks log off, we do have a few Ohio Alliance updates that we'd love to share. So we're going to go ahead and move on to the next slide. Let's go one slide back, and this is just contact information. If you'd like other ways to connect to the Department of Mental Health and Addiction Services, you can see the information regarding the Ohio MOS listserv, and then their other modes of connection here. Next slide. We want to make sure that the learning objectives that Amy outlined were met. So we're going to pop up a quick poll. If you could please just take this poll in response to these objectives. We do want to encourage 100% participation, so I'll just give it a few more seconds for you to provide your feedback. All right, terrific. And for our healthcare provider partners and school partners on the call, if you are not already, we do encourage you to become a member of the Ohio Alliance. And you can do that by filling out the application form or scanning that QR code. So you can see both the link and the QR code. And you're, of course, welcome to ask us any questions about membership and benefits. Next slide. We do have 2 upcoming quarterly meetings for 2024. The next one will be in September and the following in December. So want to put that on your radar, and you can register for those quarterly meetings by scanning the QR code. And this is an opportunity for us to provide topic-specific updates for our our school-based health partners across the state. We did want to share, if you have not already seen, that the Ohio School-Based Health Center census data is now available on our website. You can go to our website, pop it into the checkbox, osbha.com. Under resources, you'll find the census link, or you can scan the QR code here. And then, of course, we welcome you to follow us on social media if you don't already. We provide a lot of our updates about our programming and our resources through our social media networks. So I encourage you to follow if you have not already. And we are on Instagram, X, and LinkedIn. And then please make sure that you're signing up for updates through our biweekly newsletter. And you can join through that survey link, or that mailing list serve link, or the QR code that you see there. And that will wrap up our Lunch and Learn this afternoon. If you are registered for continuing education credits, the code word for receiving those credits is going to be Ohio Alliance, capital O, capital A. Again, Ohio Alliance, capital O, capital A. And if you are registered, you will receive some additional information about how to registered and in attendance, you'll receive some additional information about how to get those health professional credit hours. Again, the code is Ohio Alliance, capital O, capital A. And with that, we will conclude our Lunch and Learn for this afternoon, and look forward to seeing you on our other programming. Thank you so much. And thank you to our guest presenter, Amy, for the great information she shared. We hope you're able to apply it in your school-based health settings. Thanks, Amy.